Welcome to Q&A with, a show where I focus on the role behind the person to give you some insight into how to operate in their world.
Hello, my name is Davo, and today we have
Dr. Dami Jagun. I am a Dermatology Registrar.
Thank you for being here.
Thank you.
So when I think of dermatology, I instantly think of skin.
Mm-hmm.
But how would you describe your role than just, they deal with skin?
I think it's a good question because it's a very common misconception. So a dermatologist is a medical doctor who specializes in dealing with diseases affecting not just the skin but also the hair and the nails. And we undergo training to enable us to do this in a very professional manner.
Okay, so it was I guess a very ignorant of me just to think of skin when it's actually quite a more of a holistic approach to the body.
I wouldn't use the word ignorance. It's a very, very common misconception. And even for some doctors, they also just assume that all we do is skin. And I think it goes back to the fact that the word derma, in terms of the Latin origin, probably does refer to skin, which is why people think dermatology is the study of skin, because ology refers to the study of. But, in reality, it is more than just skin.
Okay, well then I feel a bit at ease then if it's also doctors getting it wrong. How would it differ from, I guess, a beautician or somebody else who deals with the skin in terms of how it looks?
Yeah. So I think, there's a lot of overlap with what dermatologists do as well as beauticians or estheticians. The big difference, obviously, is that we are medical doctors, and so we've undergone medical education through medical school. That normally takes about 4 to 6 years, depending on if it's your first degree or if you've done another degree before. In addition to that, because there are doctors that also are, that do work in the skin space. So one of the key differences is that we also undergo dermatology training to be more specific. And undergoing dermatology training is not just the end of it. You also have to do exams, to come out at the other end as a consultant dermatologist. So there's quite a huge difference in terms of the length of training that we have done in comparison to some other fields out there. But the other thing that I will say is we deal a lot with diseases.
Okay.
So it's not just the aesthetic appearance of skin. And even with dealing with aesthetics, it's important to know if there is an underlying disease process, because sometimes it's not just masking the disease, it's actually going to the very root and taking it from there.
Would it be best to say one deals with the symptoms and the other deals with the cure?
Okay, so I'd say it's probably a bit of both in terms of what we do as dermatologists. We're able to deal with the symptoms, the root cause, as well as the cure. Whereas with estheticians, they're able to deal with some elements of the treatment. Now, I think where they come in very handy, because, I think we all need each other. I don't believe in putting one down, in
on
place
beauty
of the
supremacy.
other. Yeah. Exactly. Beauty supremacy. No, not about that. So I think one of the areas where they come in very handy is, with some of the more aesthetic or topical treatments. And that's mainly because within dermatology in the UK, we don't do as much cosmetic dermatology as some of our colleagues in other parts of the country. And one of the key reasons is there's such a huge shortage of dermatologists to begin with. And medical and surgical dermatology comprises a huge amount of our workload. So when it comes to the more cosmetic side, although more and more dermatologists are leaning into that, estheticians are there and they're able to fill that gap to some degree. I think with dealing with the cosmetic side, it's always very, very key, always very important to have the diagnosis at hand and not just to treat blindly and say, there's a dark spot here, I'm just going to treat it with this. You need to know what's causing the dark spot to begin with so that you can give the right treatment. So I think there's a lot of partnership that we can do together.
Okay, so that's a nice way of putting it, actually.
Yeah.
When you introduce yourself as a dermatology registrar.
Yeah.
What exactly is the function of that role?
Right, so a dermatology registrar is a doctor in training who is completing 4 years of their dermatology higher specialist training in order to become a consultant dermatologist.
I understand what you mean by that, but it's not the fact that you're training to be a doctor. You already are a doctor. You're training to your specialism.
Absolutely. So you're already a doctor. You've already completed 4 years of general medicine before you then start the training. Yeah.
So why the interest in dermatology? What's so appealing about it that you decided this is what I want to do?
Okay, so it's a really interesting story for me because I did not start off wanting to do dermatology. It was quite far away from what I thought I would be doing. And I remember specifically in medical school, one of my friends was going to do dermatology, and I just thought, why? Like, it's gross. You're going to be looking at ulcers all day. The irony was at the time I wanted to do infectious diseases, which, isn't as glamorous. But one of the things that made me change course was just absolutely falling head over heels in love with hair, which just sounds really weird. But a few years ago, probably many years ago at this stage, there was a whole natural hair movement where a lot of women, of African ancestry had decided to wear their hair in the natural state without putting chemicals in it. And I got swept up in that movement. I became really interested in understanding hair, what it's made up of, how it grows, what are conditions that can affect it. And I just thought, given that I'm really passionate about this and I have a medical background, dermatology is the sensible choice. But in addition to that passion with hair, I've always liked surgery, even before I went into medical school.
Yeah.
And so dermatology is one of those specialties that beautifully mixes medicine and surgery together. And so it just perfectly encapsulated my desires, really.
Like you said before, originally that dermatology is not just about skin, and it was hair.
Not even skin that got me interested.
That inspired you to get into it.
Yeah.
You touched upon this before about your education into dermatology and so forth. But what courses did you take, and how did you prepare yourself, I guess, in college and then university and then afterwards too? I know you didn't decide on dermatology just then, but what was the route you took?
Okay, so that's it. Yeah, so it's been quite an interesting journey for me. Because whilst in medical school, like I highlighted, I just was not interested in dermatology. Now, when I started working in the first 2 years as a doctor was when I, stumbled upon hair and just fell madly in love. And so I started thinking, what can I do to get to the end goal, which is becoming a dermatologist, because I desperately want to do this. So one of the options that I took, which isn't always a popular option, was to just delve deep into dermatology. And by that, I ended up doing a master's in clinical dermatology for a year. And one of the reasons I thought that was important for me, it's not going to be important for everybody else, was because I didn't have as much dermatology exposure in medical school. I don't recall having a very prolonged rotation. I think I may have had one in pediatric dermatology, but adult dermatology is quite a huge section. So by spending a year doing the masters, I got to really understand what dermatology was about. I got to spend some time in clinics and make a really informed decision that this is definitely what I want to do. So that was step one, which was getting the master's. Then step two is, doing my core medical training, which is now called internal medicine training. So a slight change of terminology, because you cannot go into the specialist training program, especially if you're going through the medical route, without doing the core medical training. There are other routes of getting in, which we could talk about later.
Yes.
If you're following the medical route to become a dermatologist, and I say that because there are two other routes you could take, which are a bit less popular, is you have to do, general medicine training.
Yes.
As part of that training, you are expected to complete your membership exams. And so along the medical route, that would be the membership of the Royal College of Physicians. And after completing those exams, you can then apply for training. Because it's one of the most competitive specialties to get into, there are things you need to do to differentiate yourself.
Okay.
And these would rank in terms of, teaching experience, research, audits, presentations. So I had to build those elements into my CV to ensure that I would be suitable for an interview. And I think it's really important for people to plan ahead because, it's great if you know what you want to do right from when you're in medical school because you have all that time to plan. But even if you decide at a much later time, everything is possible. So just know what you're lacking and how you can, fill in those gaps. In addition to all of those things, I spent some time working as a clinical fellow in dermatology, which is not a training post, but that was very, very useful in building up my clinical acumen, my clinical skills, such that when it came time for interview, I was quite well-rounded at that stage.
Okay, this sounds like a lot.
It is a lot, a whole lot.
But you're here now, so congratulations,
yes,
and well done.
Yeah.
With the qualifications or the masters and so forth, is that internationally recognized?
It's a difficult question to answer, to be honest, because there are people who've done a master's in clinical dermatology, and in their own countries that's recognized. But in the UK, that would not be recognized because you need to have a more comprehensive training rather than a 1-year master's. So in other English-speaking countries in the West, so say in Australia, New Zealand, Canada, they will recognize your CCT,
the traditional Commonwealth
from the
countries.
UK, exactly. Yeah. Whereas maybe the US, for example, will not recognize it, but they may want you to, do a couple more years of training added on, rather than using that in place of their own training. Yeah, so it depends on the country.
So
really.
It's case by case, as you said, and like you said before, people should do their research beforehand as well to make sure A equals B and B equals With dermatology, it's not just sort of one size fits all. There's I guess there's a specialist that deals with adults, one that deals with children, one that deals with what certain body part.
So within dermatology itself, there are lots of subspecialty roles. And so you have people, like you rightly said, there are dermatology doctors who are pediatric dermatologists. So their main focus is children. Within adult dermatology, you don't really have adult dermatologists per se. You probably just call them general dermatologists. But even within that, some people have a special interest in specific diseases. So you can have dermatologists with a special interest in immunobullous diseases, so blistering skin disorders. You can have others with a specialist interest in genital or vulval or penile conditions.
I'm so mature, I don't know why I laugh like that.
You have people who specialize in hair. You have people who specialize in conditions of excessive sun exposure, if I can call it that. You have those who specialize in skin cancer. So there are so many subspecialties within dermatology itself.
I'm upset with myself that I didn't see it as in terms of specialism based on issues per se. I was just thinking
just body part
or age or
it's a combination. No, it's a combination. Some specialisms are age, such as pediatric derm. Some specialisms are body parts, such as hair. There's people who specialize in just nails, people who specialize in, like I mentioned, genital dermatology, and then there are those who specialize in diseases. So some may have a special interest in acne, in rosacea, psoriasis, and the list goes on.
It is really very interesting. That's a lot as well.
Very, very broad.
The possibilities could be endless, really and truly.
Absolutely. And I think one of the reasons is the skin is the largest organ, so there's so much that can go wrong with it, which is why lots of people would have different special interests. I mean, you could be a general dermatologist without a special interest, and there are lots of dermatologists like that out there. But some people just get really excited about area.
So once you've stepped into the world of dermatology, what routes of employment exist? Is it NHS, private practice, 9 to 5, consultancy?
Okay. So once you become a consultant dermatologist, you can work usually in the NHS. And the reason I say that is although private practice is available, usually you need to have done some NHS work before you can go fully private. So you can't just complete your training and go straight into private practice, which some of our colleagues in other countries can do. You're expected to have done some work within the NHS. But within the NHS, you can work part-time, full-time, within a locum capacity where you are filling rota gaps. And then, of course, there is the option to work private as well. And within private practice, you can either work for a practice or you can start your own practice. There's quite a bit of variability.
What are the type of clients or patients that you see?
Okay, so in terms of the demographic, it pretty much will depend on what part of the country you're living in. So with where I work, I don't live in a big city. I don't practice in a big city, and the population, that lives around there is predominantly white or Caucasian.
Yes.
So I'd say probably 80 to 90% of my patient demographic would be white or Caucasian. And maybe the other 10 to 20% would be other ethnic groups, so Asian, Black, or people of African ancestry, Chinese, and the like.
And what are the most, I guess, common issues?
Yeah, so that's a really interesting question because it will depend on where you practice as well. And there was a study that was published a few years ago by a consultant dermatologist in London where they were looking at the common presenting complaints in different ethnic groups. And you find that what people of a certain ethnic group are presenting with might differ slightly with those of another ethnic group. So where I practice is predominantly white, so the vast majority of what we see is skin cancers. We also tend to see lots of eczema, lots of psoriasis, lots of acne. Those are pretty much your bread and butter of dermatology. Every single clinic, you will see at least one of each of those. I think one of the things that keeps dermatology very interesting is you would always learn something new. You can never overlearn dermatology. So even though there are certain conditions that you see day in, day out, once in a while, you will come across something that you haven't seen before, that you have to dig through the archives of dermatology textbooks and journals, that you would sometimes get the odd rare case.
Yes.
So on one hand, that can be very exciting, just from a purely intellectual level. Yeah. But on another hand, for the patient, it can be a bit anxiety provoking, seeing that, okay, this is not something very common. But that being said, in as much as we do our best to treat patients, to manage their conditions, there are times that despite your best efforts, patients may have a condition that's gotten so severe that it just does not respond, and that can be really heartbreaking, when, a patient has a condition and they're not responding to treatment, and in the worst case scenario, they die from that. Yeah, I think sometimes we don't think that people die in dermatology, but it can happen.
Yeah. So, and again, I say skin, but when I say skin, I mean just anywhere really.
Yeah.
But just how important is skincare, and is it often the case where we neglect it and we seek help when it's too late?
So I'd say I'll come at this from two different angles. So with skincare, I think it's very important, especially in some conditions, because having a healthy skin barrier is critical, to having, perfectly functioning skin. And so in terms of choosing the right ingredients, that can be critical, and that can be the difference between having a flare of a skin condition and not having a flare. So for example, patients that have eczema, what they're putting on their skin is very, very important, because the wrong thing can cause them to have a flare. Another group would be patients with rosacea. It's really important they're not using inflammatory ingredients on their face. Even people with acne, it's important that they're not using, skincare products that are going to make them prone to developing more acne, or even beauty products as well. People with pigmentation problems, it's important that they're wearing sunscreen, and just, people with really fair skin in general, like, you definitely want to be wearing sunscreen to prevent your risk of getting skin cancers. So I think everybody does require skincare to some degree, but that would depend on what your end goal is, what your risk factors are as well. Now, in terms of, you mentioned something about maybe sometimes, things are a bit too late.
Yeah.
And that. I think what I'll just say to that in general is, if you notice something on your skin, and you're not sure, just go see a doctor. Don't try, whipping up all manner of remedies at home. Maybe grandma's recipe.
I feel attacked because
sorry. Maybe grandma's recipe that worked for her and many other generations, but just get a professional to look at it, because in as much as some of these, self-made products,
yes,
may sometimes be helpful, sometimes they can actually cause more harm than good.
Yeah. You're directly talking to me with this one. So then, I guess, what would you say are the pros and cons of, working within dermatology?
This is something I've thought about, and no specialty is perfect. I really struggle to find cons of dermatology because I think it's just such a great specialty. So I guess I might focus on the pros for now.
Okay.
So I think one of the pros is just variety. Variety is the spice of life. So every day you can go into work, you're going to see something completely different. I particularly love dermatology because it's one of those few specialties in medicine that has that nice mix of both medicine and surgery. So you could be operating in the morning, cutting out a skin cancer, and in the afternoon you're seeing a child with eczema. So the variety is just unmatched. I think also it's a very rewarding specialty, as lots of other specialties are. But dermatology, being very visual, it's so nice to have a patient come in, you've prescribed something, and you can physically see that their skin is better. And I think that's something that you just don't get in other specialties, like just that visual element.
Now that you mention it, I guess it's almost a double win, because yes, you've helped them physically, but mentally as well.
Yes,
it uplifts them.
Absolutely. And I think sometimes when you don't suffer with a skin condition yourself, it might be easy. It might be easy to underestimate what your patients are going through. Because very oftentimes we prescribe creams and it's like, oh, use this, 3 times a day.
Yeah.
But yourself, how many times, would you naturally just moisturize twice a day or even once a day? So it does take a lot of patients' time, using all these treatments. So when their skin can get to a place where it's better, it really uplifts them. For some people, especially if they're struggling with acne, it can really affect their self-confidence. People with psoriasis with very visible patches, sometimes they don't want to go out, they could become quite depressed. So being able to help these patients, like you rightly said, it's not just the skin, but it's also, mental health as well.
Okay. So then, as we come to a close, I'm going to ask you the most important question. What song would you like to include in our playlist?
It has nothing to do with dermatology. But it's just been my jam lately. I really like Booga.
So it was just the artist and the song.
Because I don't know the artist. I just know that the song is called Booga and it's a jam. I think it's Kiss Daniels. Okay. I'm not sure, but
okay.
I think it's Kiss Daniels.
We'll find it.
Yeah, really, really nice.
Thank you. Thank you for your time.
Yeah, you're very welcome. I am Dr. Dami Jagun, and I am a Dermatology Registrar. You are watching Osani TV.
If you've enjoyed this video, please do comment, like, share, and subscribe.
Osani TV, it is a wrap.